Hey familia, Dr. Alex here. I wanted to quickly answer the question, why do I need to be taking my blood pressure? Now, I recently got this question from a client who just started with my 90-day metabolic makeover. Now, um, she does not have high blood pressure. She does not have hypertension as a diagnosis, but I require people who are in my 90-day metabolic makeover to take their blood pressure, and not even just once a day. I require you to take your blood pressure every morning and every night. Now, why do I do this if you don't have high blood pressure? Very simply, blood pressure is one of the first signals that something could be happening inside of your body, where you could be heading to a bad direction. And this goes back to my many, many years of working in cardiac ICU. One of the first things we do to somebody when they come to us is we hook them up to the blood pressure machine, to the cardiac monitor, and we get those vital signs. We're looking at the blood pressure, we're looking at the heart rate, we're looking at your oxygen level, we're looking at all of that. There is a reason. When I start to see those numbers change and not for the good, I know that you are headed to a bad place. I know that something is about to happen. So that way I can intervene, do some more assessments, and see what's up before you get to that bad place. So when I am monitoring somebody remotely, like I'm doing in my 90-day metabolic makeover, I want to know what your blood pressure is, what your heart rate is on the daily, morning and night. And even if you're a woman who is not in my 90-day metabolic makeover, male or female, if you're not in my program, I still want you to be taking your own blood pressure every single day, at least once a day. Every person should know what their blood pressure is. It is one of the most important things that you should know about yourself. Besides like your cell phone, your social security number, all of that, you need to know what your blood pressure is. So often I've had patients come in, they have no clue what their blood pressure is. And I take their blood pressure and it is sky high. And I'm like, is this normal for you? Is this one of your normal blood pressures? They have no idea because they don't ever take their blood pressure. They don't ever go to the doctor. They don't know. You need to know what is normal for you. And I always put it in that context because every person is different. Everybody has their own normals. What is normal for you? Because when you start to deviate from what is normal for you, then that's an indicator of something happening to your body. So I want to know. So that is why I ask you to take your blood pressure every single day. And we can tell a lot from those numbers. If they are very far apart, if your top number and your bottom number are very far apart, I know something's going on. If they are close together, I know that something is going on. So those numbers are so important. They can tell so much about you and what's happening inside of you. And especially if you're doing some type of physical health program, whether you're doing my 90-day metabolic makeover or whether you're doing something else. And especially if you are intermittent fasting and you're doing things that are really creating some dramatic shifts inside of your body with your hormones, with your chemical levels, your sodium, your magnesium, all of that. That creates a lot of fluid volume difference in your body. And all fluid volume difference means is that how much volume of blood and fluid that your heart is pumping throughout your body. So if you start to experience symptoms like headache, dizziness, nausea, all of that, it's going to show up in your blood pressure. It's going to be able to help me intervene and give you some suggestions so that you can start to feel better quickly instead of suffering and feeling sick when you don't need to be. There are things we need to do, but that's precisely why you work with somebody like me in a program like the 90-day metabolic makeover, so that you can get that individualized attention and know exactly what and why things are happening to you. So take your blood pressure every single day. Please know what your blood pressure is. Go get an electronic cuff from the store. Go get an arm one, go get a wrist one. I have one on my watch that I use very frequently. If you follow my stories, you will see it. Take your blood pressure. I used to be on 2 blood pressure medications. They wanted to add a third one. I was like out of control. I did not want to have that type of life anymore. So I decided to make some huge changes. And now I am no longer on any blood pressure medications, no heart failure, none of that stuff. And I've done it naturally. I continue to keep it up naturally. There are things that you can do to get off of that, because I know there's so many of you out there who feel like you're way too young to be taking all these pills. But that is what traditional medicine wants to get you to take. Just take these pills, take these pills. They don't address the root cause of the problem. That's why I'm here. Time to change that all up. Time to intervene. We can do things so much more simply and so much more naturally. Okay? So take your blood pressure every day. Moral of the story, not difficult. And you can always find information about what your numbers mean. Take those numbers to your doctor. Please use that information for your benefit. It will only help you. Okay? All right, guys. I will catch you next time. So for a balanced life, just add spice. Take care.